Nearly 1 in 5 Americans do have a mental illness, and that's why May is Mental Health Awareness Month, to remind us to pay attention to our own well-being. Joining me is Dr. Annie Deming, a psychologist for Intermountain Primary Children's Wasatch Canyon's Behavioral Health. Dr. Deming, thanks so much for taking the time this afternoon. How can we recognize and begin taking steps to address our own mental health?
It really starts with being mindful and aware of what's happening to us on a daily basis. We experience multiple emotions throughout the day, ranging from happiness to joy to irritation and frustration. And really tuning into those feelings and understanding that they're normal and natural to have is really the first step.
Let me ask you, what if it's not ourselves suffering, but a family member or friend, and we're noticing these red flags that maybe they're dealing with some mental health issues? How can we step in and help them?
Yeah, opening up and talking to them, asking them the hard questions. How are you doing? I've noticed that things are changing, or I've noticed that you've been seeming down lately. How can I help? Really just allowing them to share what they're experiencing, and then having that really important conversation is important.
And talking it out. You deal with children all the time. What if you see or recognize symptoms in your own child, one that's perhaps very young, where it's hard to have these difficult adult-like conversations with? How do you ask them those important questions?
Yeah, so it's keeping those lines of communication open and also labeling. Kids learn very fast and they feel emotions even when they don't have the words for them. So as parents, it's important for us to provide those words to them. So, wow, it looks like you're really upset about that, or it looks like you might be feeling scared or nervous about a certain situation. So giving them the words and then allowing them to respond and explain what they're going through.
I did want to ask you about the post-COVID anxiety. What is that, and how often are you recognizing that and seeing that now in patients?
Yeah, so we're seeing patients really struggle to transition away from the way our lives have been for the last, several months compared to what they're looking like now. There's still a lot of uncertainty and, what should I do with the mask? What should I do with friends? And we're all having to navigate that. I think one of the most important things to remember is it's okay to kind of take your own personal time, and what feels right for your family is okay to do, even if it feels different than another family.
Such good advice and tips. Again, with May being National Mental Health Awareness Month, where can people go for help? I know there's plenty of resources within our communities.
Yeah, our community has great resources. So Intermountain Healthcare has a specific phone number that parents and people can reach out to. You don't have to be a parent, just if you need any sort of mental health guidance or advice or connecting to resources, we have a specific behavioral health navigation phone line that parents can call or people can call.
And we have that phone line right up on the screen right now for everyone to see it. If you aren't catching it now, we'll always have it on our website. Go to fox13now.com and click on Wellness Wednesday. Dr. Annie Deming with Intermountain Healthcare, thank you so much. Very important topic we were able to touch on here. I appreciate it.
Thank you.